Most men will notice a change in their water habits. Typically, this starts at around the age of 50 plus. Men are very worried it's cancer, but in the absolute majority, it's not. The typical symptoms are that when you go to pee, it's difficult to start. You'll visit the toilet quite often, and then you feel that you didn't empty completely. Some men start waking up at night. Others need to strain in order to push urine out. These are all typical symptoms that men experience, and when they do, they need to seek medical attention. So typically, from a medical point of view, it's a combination between genetics, the environment, and hormonal factors. But we all know from a urology point of view that as we start growing older, the prostate starts enlarging more. Prostate starts enlarging actually at the age of 25. But then after a couple of decades, and that would end up into the age of 50, one starts experiencing the troubles of an enlarged prostate. Urologists recommend that you should cut down on your alcohol intake, on your caffeine intake, and as well on fizzy drinks. So basically, you need to switch to decaffeinated beverages. Limiting your intake of artificial sweeteners is very important. If you are diabetic, you have to have a better attention at your sugar controls. You need to exercise regularly and lose weight, because we know that men that do invest in a healthy lifestyle actual benefit. And of course, if you are waking up at night to pee, your last drink should be 3 to 4 hours before sleep time. If you go a little bit back in time, we only had a couple of options. But nowadays, there is a whole spectrum of choices that patients can consider. This will depend on the lifestyle of the patient, on their age, on their health status, and as well on the size of the prostate. Your doctor needs to run some investigations, which can be a blood test, typically a PSA, a rectal exam, an MRI scan or an ultrasound to measure the size and shape of the prostate, and as well a camera test to look inside the bladder and see the anatomy from the inside. Then depending on these, there are various options that one can explore. Not everyone is eligible for all the treatments. A man will find that there are the following options. Number one is urolift, where basically clips are inserted, and this procedure can be done under local anesthetic or general. And basically what it does is squashes the prostate, opening the channel. There is the classical transurethral resection of the prostate, called TURP, where we shave off the prostate from the inside under general anesthetic, and that will open the passage. There is laser enucleation, where the prostate is basically shelled and then is fragmented with a special instrument, and that opens as well the channel. There is aqua ablation, which is a type of robotic water jet, where after an ultrasound measurements are done, then the surgeon will use the water jet to destroy the prostate. And there are other treatment modalities, like, for example, prostatic arterial embolization or radium, which are basically alternatives. However, they are not the mainstay choices. In terms of side effects, it depends on which procedure you take. However, typically men will experience an initial change in their water work habits, so they find themselves spending a penny quite often. They may see some blood. They may not hold the urine, and they can get wet. Risk of incontinence is very, very small. Some of the procedures will last longer than others, and your urologist will direct you which procedure will be more suitable for you. Of course, there are others, however, they are very specific. Like, for example, some men ask, will I still see my seminal fluid when I ejaculate? So some of the procedure preserves ejaculation, others don't. And that is why you need to have a detailed conversation with your urologist.